Scanning the room. Okay. Alright, knock, knock, knock. Hello, my name's Gracie. I'm going to be your student nurse today. I'm going to go ahead and close the curtain and provide privacy and wash my hands with soap and water. Can you go ahead and tell me your name and date of birth?
Raymond Montgomery, 01/20 of 05.
Alright, I'm going to go ahead and double check that. Perfect. Can you tell me a little bit about why you're here today?
I got hit in the head with a board at work.
Alright. Are you experiencing any pain?
No,
right
not
now?
really.
And where'd you get hit in the head?
On the forehead.
On the forehead?
Yes, ma'am.
Alright. Well, today we are going to be doing a head-to-toe assessment. Is that going to be alright?
I suppose.
Alright. Do you have any allergies that I should know of?
No, that's your consent.
Alright. I'm going to be doing your vitals first. Is it okay if I touch you?
Yes, ma'am.
Alright, I'm going to take your temperature. It's 98.1. I'm going to take your blood pressure. Slide your arm through. Perfect. Put this onto your shirt. Alright. I'm going to go ahead and find your pulse. Perfect. Alright, blood pressure is 120/70. Go ahead and put that right there. I'm gonna go ahead and take your pulse with my watch. You go ahead and give me your arm. Alright, 80 beats per minute. Alright, your respiration is 20. I'm going to take your O2 stats. Alright, it's 95% is your oxygen level. And on a pain of 0 to 10, can you rate your
0.
pain? A 0? Okay. Well, I'm going to go ahead and start the head to toe. I'm going to ask you a various of questions. Just answer to the best of your ability. Do you know where you are today?
Grace Hospital.
Okay, and do you know why you're here today?
I got hit in the head this morning.
Do you know your name and date of birth?
Yes.
And do you know the President of the United States?
Donald J. Trump.
Okay. Alert and oriented ×4. I'm going to go ahead and inspect your hair and just touch it if that's all right.
I suppose.
Looking at it, it's distributed evenly. I don't see anything abnormal about it. So now I'm going to ask you if you can do a various of expressions. Can you smile for me? Perfect. Can you frown? Can you puff out your cheeks? And can you raise your eyebrows? Perfect. Okay. Now I'm going to assess your ears. Okay, no drainage in that one or that one. Perfect. Now I'm going to look in your nose. So if you just look up for me. No excessive drainage. Now I'm going to do your mouth. Can you lift up your tongue? Perfect. Can you open your eyes? Just looking at your eyes, looking at your conjunctiva and sclera, they look normal. And pupils look normal just by looking at it. I'm going to look at your pupils and see if they accommodate to my light with my pen light. So just look ahead. Perfect. All right, so now that I've done all of that, I am going to have you follow my pen light. I'm going to test your cardinal gaze. All right, perfect. So now I'm just going to palpate your temporomandibular joint, and I'm going to have you open your jaw, close, open, close. Did you have any pain when doing that?
No, ma'am.
All right, and I didn't hear any clicking at all, so now I'm going to ask you to look up a little, look down a little bit. All right, and swallow. Did you have any difficulty?
Nope.
Nope. All right, can you move your head back and forth and shrug your shoulders? All right, perfect. So, have you experienced any hearing loss recently?
No.
Or any abnormal headaches?
No.
Have you had a concussion before?
No.
All right, so now I'm going to listen to your lung sounds. Can you sit up for me? All right, I'm going to listen to your backside first.
Mm-hmm.
Just breathe in every time I move my diaphragm. All right, perfect. And I would also make sure that I'm doing this on bare skin. You can go ahead and lay down for me. I'm going to do your front side. So with the same thing, just deep breath every time I move. All right, perfect. Do you get out of breath easily?
No.
No shortness of breath or fatigued easily?
Nope.
All right, so now I'm going to listen to your heart. So I'm going to start with the aortic area first. Perfect. Now pulmonate. Perfect. Erb's points. Perfect. Tricuspid. And mitral. Perfect. Now I'm going to listen with the bell, the other side of my stethoscope. And I would also be making sure I'm doing this on bare skin. Perfect. So do you ever get any chest pain?
I do not.
No?
Nope.
Alright. So now that I have listened to the lung sounds and heart, I'm going to move to your upper extremities. So first I'm going to test the capillary refill of your fingernails. I'm just going to take 2 of your fingers, press down, and they both refill less than 2 seconds bilaterally and no clubbing on any fingers. I'm going to assess the temperature bilaterally down the arms. And it's warm and dry bilaterally down the arms, which is perfect. I am going to test for skin turgor on this arm and on this arm. This is just testing if you're hydrated. I'm going to test for edema. No edema in that arm and no edema in the left arm. So now I'm going to assess the brachial and radial pulses on your arms at the same time. So if you'll just have your arms out like that. Perfect, nice and strong bilaterally. And the radial pulses are nice and strong bilaterally. So now that I've done that, I'm gonna have you sit up for a second. Can you move your arms out like this? Perfect. And down. And can you move them in a circle? Okay, perfect. Now that I've done that, I'm going to listen to the abdomen. I'm gonna listen in all 4 quadrants. Can you lift up your shirt for me? Okay, I'm just gonna expect it. Contour is normal, it is symmetrical, no scars noted. So first I'm going to listen, starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Perfect. So now I'm just going to palpate all quadrants, and I'm going, just make sure you tell me if you feel any pain or tenderness. So just have your arms. Thank you. Any pain?
No.
Any pain at all?
Mm-mm.
Alright, when was your last bowel movement?
This morning.
Okay, and are they pretty normal?
Yeah.
And do you have any problems urinating?
I do not.
You don't?
No.
And did you have any problems when you were moving your arms up and down?
I did not.
Alright, perfect. So now I am going to assess the lower extremities. I'm going to inspect and I'm going to assess the temperature bilaterally. So when I'm looking at it, hair is distributed evenly down the legs. Temperature is warm and dry bilaterally. I am going to test for pre-tibial edema on both legs at the same time. There's no edema on either legs. I am now going to test for capillary refill on the toes. Alright, perfect. And they refill in less than 3 seconds. I am now going to push, or I'm going to have my hands against your toe or your feet, and I'm going to have you push like it's a gas pedal. Go ahead. Okay, they're both strong bilaterally, and now I'm going to put them on top, and you're going to resist my hands. Perfect. So now I'm going to just look at the feet. Skin is intact. Both feet. Now I'm just going to compare the pulses on your feet. I'm going to start with the dorsalis pedis on both feet at the same time. and they're both strong bilaterally. Now I'm going to test your posterior tibial pulses at the same time. Perfect, and they are strong, so can you stand up for me? Okay, I'm going to have you put your knees up like that, both perfect, and can you circumduct your hips, both sides, perfect. You can lay down. All right. Did you have any pain when you were doing that?
I did not.
Do you have any problems when you're ambulating, going to the bathroom?
No.
No? Okay. Perfect. Well, I am going to I'm going to lower the bed back down, and I'm going to raise the side rails. Do you need anything before I go and let the doctor know about everything?
Cup of water.
A cup of water, perfect. All right. Well, I raised the rails and I asked the patient if they need anything. I am now going to wash my hands again. And do you need anything else?
Nope.